Hi everybody, this is Dr. Douglas Stoddard, and I wanted to talk to you today about COVID-19 and specifically what we're doing in the clinic to try and ensure everyone's safety and of course comfort. As stage 2 rolled around at the beginning of June, we started working again, and now that stage 3 is imminent in the Greater Toronto area, I wanted to talk to you a bit about what we are doing. We've had 4 or 5 weeks to work things out and ensure that what we're doing is adequate and of course the best we can do. I'm happy to say that we've concluded, based on the past 5-6 weeks of doing these things, that everything's as tight as we can make it. So I wanted to go through these things with you. The first thing we're doing is screening. Of course, a lot of places are doing this on the phone. When patients call to book appointments, we're asking some very simple questions: fever, cough, shortness of breath, feelings of being unwell. And of course, if the answer is yes to any of those, we ask people to stay home, consider seeing their doctor. The good news is that nobody has called and been found to have any of those symptoms. And I think that's because people calling a sports medicine clinic, they know that generally speaking, if they have any of those symptoms, and most people are very familiar with these symptoms nowadays after dealing with this for the past several months, people just aren't calling sports clinics when they have these symptoms. So again, good news is we are screening, but have not had anybody that we felt was symptomatic in any significant way. Naturally, we depend on people to be telling us the truth, but we do feel our patients are, and therefore we're very confident that nobody has been allowed into the clinic who have any symptoms. Second thing we're doing is we've got plexiglass screens up at our front desk, separating our receptionists from our patients. Patients, of course, need to book appointments at the desk, and therefore we do have those barriers in place, both for the benefit of our reception team and our patients. The third thing we're doing is taking temperatures. Everybody who gets or has an appointment at SEMI gets their temperature taken when they arrive. Every practitioner in the clinic has their own infrared contactless thermometer. This means that these thermometers do not have to touch the patient. We don't have to put it in your ears. We don't have to put it in your mouth. We simply hold it up near your forehead, a few centimeters away, press the button, and voila, we get a temperature. And again, I'm pleased to say that nobody yet has had a fever who has come into the clinic, and we've had to send nobody home, which is of course what we would do if we found anyone to have a fever. The fourth thing we're doing is wearing masks. All staff are wearing masks when in the presence of patients, and there's no exceptions to this rule. And so at the end of the day, we are protecting each other with the use of masks. Now, we do have a supply of masks. If you come to the clinic and forget yours, we encourage you to bring your own, but if you don't have one when you arrive, we will give you a mask. Personally, I've needed a mask when I've gone to several places because sometimes I forget mine, and I'm always happy when they have theirs. Now that the City of Toronto has made it by law that we all have to wear our masks, hopefully we're all now leaving our houses with masks. But again, if you arrive without one, we will supply you with a mask. Additionally, we are cleaning. We always clean in our clinic, but now more than ever, we're doing that. We have special disinfectant sprays where we're washing down surfaces, handles, tables, desks, everything we can. We are doing our very best to keep things clean. Gym equipment, when patients have touched it, we are cleaning between patient sessions, etc. So again, doing our very best to keep everything clean. Social distancing, we are doing our very best to stay 6 feet away from people, except of course when we as doctors or therapists have to examine or treat patients where we need to get closer. But the clinic has been set up to enable social distancing. People in the waiting room, the chairs are 6 feet apart. Beds in the treatment areas are at least 6 feet apart. And we're doing our very best to maintain these distancing policies. The final thing we're doing is one-way traffic through the clinic. We're allowing people in the front door. We're asking them to exit through a back door. And if they need to get back up to the front of the clinic regarding booking appointments, etc., once they've exited the back door, they can actually just continue up and re-enter through the front door. So we have one-way traffic as best as we can. All in all, as safe as we possibly can make it. The good news is if you venture out of your house with a mask on, social distancing, washing your hands and not touching your face. The chances of being infected with COVID-19 really are still very low. But nonetheless, we're doing all of these things in the clinic to once again try and keep everybody comfortable and feeling like they can venture out to SEMI and get some treatment if they feel they need it. So if you've been sitting on an injury for the past little while, scared perhaps to venture out and get it taken care of, please feel confident. I think with all these measures in place, SEMI and our clinic is a safe place to be. Thanks again for listening. This is Dr. Douglas Stoddard.